Hi friends, welcome to PharmaCrit. So in this video, we are going to discuss more clinical oriented questions or patient case study based questions. So starting with today's first question, a 65-year-old woman with impaired renal function and a necrotic ulcer in the sole of her right foot is admitted to the ward from the emergency department. She has long-standing type 2 diabetes mellitus and you wish to examine her retinas for possible vascular changes. Which of the following drugs is a good choice when pupillary dilation but not cycloplegia is desired? The options are isoproterenol, norepinephrine, phenylephrine, pilocarpine, tropicamide. So here we need to find out the good choice of a drug or drug of choice that produces only pupillary dilatation but it should not be cycloplegic. So here the correct answer is option C, that is phenylephrine. Cycloplegia refers to the temporary paralysis of the ciliary muscle in the eye, leading to a loss of the eye's ability to focus on nearby objects. This paralysis is often induced by eye drops containing cycloplegic agents. Cycloplegia also causes pupil dilation, also known as mydriasis. Antimuscarinics, for example, tropicamide. So here option E, which is tropicamide, it is both mydriatic and cycloplegic, so it is not a good choice. Then alpha sympathomimetic agonists are only mydriatic in the eye, which can be a good choice. Isoproterenol has negligible effects on the eye. Norepinephrine penetrates the conjunctiva poorly and would produce intense vasoconstriction. Pilocarpine causes meiosis. So, and the next option or the correct answer is phenylephrine because it is well absorbed from the conjunctival sac and produces useful mydriasis for 10 to 30 minutes. Remaining all other options are not a good choice for pupillary dilatation alone. Hence came the correct answer as phenylephrine, which produces useful mydriasis for about 10 to 30 minutes. Next one, a 60-year-old immigrant from Latin America was told that she had hypertension and should be taking antihypertensive medication. She decides to take an herbal medication from an online holistic pharmacy. 1 week after starting the medication, she is found unconscious in her apartment. In the emergency department, her blood pressure is 50/0 mmHg and heart rate is 40 beats per minute. Respirations are 20 per minute. Pupils are slightly constricted. Bowel sounds are present. Which of the following would be the most effective cardiovascular stimulant? The options are amphetamine, clonidine, isoproterenol, norepinephrine, tyramine. So here the correct answer is option D, that is norepinephrine. Herbal medications often contain potent synthetic drugs in addition to or instead of the advertised constituents. This patient shows signs of sympathetic autonomic failure characterized by hypotension, inappropriate bradycardia, constricted pupils. So these signs are compatible with a large overdose of a drug that causes marked depletion of stored catecholamine transmitter such as reserpine. Reserpine is an absolute but inexpensive antihypertensive agent. The indirect agents, see the options amphetamines and tyramine, act through catecholamines in or released from the nerve terminal and would therefore be ineffective in this patient. Then clonidine, it is a central sympathomimetic drug. It acts primarily on presynaptic nerve endings, although it can activate alpha 2 receptors located elsewhere. Isoproterenol would stimulate the heart but has no alpha agonist action and might exacerbate the hypotension. Now let's see the answer. The remaining all other options are wrong. Then we choose the answer as option D, that is norepinephrine, because it has the necessary combination of direct action and a spectrum that includes alpha 1, alpha 2 and beta 1 effects. Next question. A 32-year-old woman with hypertension wishes to become pregnant. Her physician informs her that she will have to switch to another antihypertensive drug. Which of the following drugs is absolutely contraindicated in pregnancy? The options are atenolol, losartan, methyl dopa, nifedipine, propranolol. So in this question we need to find out the drug that is absolutely contraindicated in pregnancy. So here the answer is option B, that is losartan. See the options here. Atenolol is a selective beta blocker. Losartan is an angiotensin receptor blocker. Then methyl dopa, nifedipine is a dihydropyridine calcium channel blocker, and propranolol is a non-selective beta blocker. Among these options, methyl dopa is often recommended in pregnant patients because it has a good safety record in pregnancy. Calcium channel blockers and beta blockers are not contraindicated. In contrast, AC inhibitors, that is angiotensin converting enzyme inhibitors, and ARBs, that is angiotensin receptor blockers, have been shown to be teratogenic. Okay, hence we choose the drug as losartan because it is an ARB, angiotensin receptor blocker. It is absolutely contraindicated in pregnancy due to its teratogenic potential. Moving on to the next question. A patient is admitted to the emergency department with severe tachycardia after a drug overdose. His family reports that he has been depressed about his hypertension. Which one of the following drugs increases the heart rate in a dose-dependent manner? The options are captopril, hydrochlorothiazide, losartan, minoxidil, verapamil. Here the correct answer is option D, that is minoxidil. AC inhibitors, ARBs, and diuretics do not significantly increase the heart rate. Although dihydropyridine calcium channel blockers do not usually reduce rate markedly and may increase it, verapamil and diltiazem both are non-dihydropyridine calcium channel blockers. These drugs do inhibit the xenoatrial node and predictably decrease the heart rate. Okay, so the remaining all other options are wrong. Now we came to the correct answer, that is option D, which is minoxidil. It is a vasodilator. Other direct vasodilators regularly increase heart rate, and minoxidil, a very efficacious vasodilator, causes severe tachycardia that must be controlled with beta blockers. Next one. A 60-year-old man presents to his primary care physician with a complaint of severe chest pain when he walks uphill to his home in cold weather. The pain disappears when he rests. After evaluation and discussion of treatment options, a decision is made to treat him with nitroglycerin. So this is the major question. So under this question, we will discuss three minor questions. Okay, or under this question, we will discuss three more questions. So among this, the first question is, which of the following is a common direct or reflex effect of nitroglycerin? Nitroglycerin is an anti-anginal drug. So the options are decreased heart rate, decreased venous capacitance, increased afterload, increased cardiac force, increased diastolic myocardial fiber tension. So here the correct answer is option D, that is increased cardiac force. This is because nitroglycerin increases heart rate and venous capacitance and decreases afterload and diastolic fiber tension. It increases cardiac contractile force because the decrease in blood pressure evokes a compensatory increase in sympathetic discharge. Hence, the common direct or reflex effect of nitroglycerin is increased cardiac force among these options. Next one, in advising the patient about the adverse effects he may notice, you point out that nitroglycerin in moderate doses often produces certain symptoms. Which of the following effects might occur due to the mechanism listed? Or else we can say that which among the following is one of the most common adverse effects associated with nitroglycerin? The options are constipation, dizziness due to reduced cardiac force of contraction, diuresis due to sympathetic discharge, headache due to meningeal vasodilation, hypertension due to reflex tachycardia. Here the correct answer is option D. The nitrates relax many types of smooth muscle, but the effect on motility in the colon is insignificant. Nitroglycerin causes hypotension as a result of arterial and venous dilation. Dilation of arteries in the meninges has no effect on central nervous system function but does cause headache. So one of the most common adverse effects associated with the nitroglycerin is headache. Under the major question 60, the third one question is, 1 year later, the patient returns complaining that his nitroglycerin works well when he takes it for an acute attack, but that he is now having more frequent attacks and would like something to prevent them. Useful drugs for the prophylaxis of angina of effort include. The options are amyl nitrite, esmolol, sublingual isosorbate dinitrate, sublingual nitroglycerin, verapamil. So in this question, we need to find out the drug that can be used for the prophylaxis of angina of effort. Here the correct answer is option A, that is verapamil. It is a non-dihydropyridine calcium channel blocker. The calcium channel blockers and the beta blockers are generally effective in reducing the number of attacks of angina of effort, and most have durations of 4 to 8 hours. Oral and transdermal nitrates have similar or longer durations. Amyl nitrate and the sublingual nitrates have short durations of action, that is a few minutes to 30 minutes. Esmolol, it is an intravenous beta blocker. It must be given intravenously and also has a very short duration of action. So these drugs are of no values in prophylaxis. So here we can choose the drug of choice, or the drug that can be used for the prophylaxis of angina of effort is verapamil. So with this question we have completed today's question discussion series. Thank you everyone for watching this video. Please like, share and support. Have a nice day.